Hello everyone, my name is Dr. Hamza Al-Ashwar. I'm going to record helpful videos for MRCS examinations. Firstly, we start with the thyroid case. Okay, we have a frame that's help to gain more marks. Firstly, after introduce the room, wash your hands, introduce yourself and confirm the patient details and explain the examinations and gain the consent and ask about the pain and ask the patient for the exposure and offer the chaperone. After that, we go for the thyroid gland examinations, and after that, we go for thyroid status examinations. And don't forget, finally, after that, thank the patient and wash the hands. Okay? By details, wash the hands, introduce yourself by hello, good afternoon. My name is Dr. Hamza. I'm one of the surgical doctors. Could you please confirm your name and age, please, to confirm the patient details? After that, explain the examinations. I'm going to examine the swelling in your neck. Was that okay with you? Which including look and listen and also feeling and doing some special tests. And the most important, to ask about the pain. Do you have any pain at the moment? And skip for the exposure. Could you please expose your neck and your upper chest and go for the chaperone by offering the examiner with you as a chaperone. After that, we go for thyroid gland examinations. As in swelling, we go for inspection, palpation, percussion, auscultations. By inspections, we look for the 6S size swelling, size, symmetry, skin scars, and so on. And don't forget to look at the neck veins and also look at the neck while the tongue stick out. And look at the neck while swallowing the water. After that, we go for palpations, and it's important to ask about pain before you start palpations. Do you feel a pain at the moment? Again, okay? Do you feel a pain? Do you feel any pain at the moment? And go for the back. From the back, feel the lump, feel the tenderness, temperature, surface, age, consistency, fixity, pulsatility. And go for palpate while the patient swallow water, palpate while the patient stick out at his tongue, protrusion in the tongue. And after this, it's important to check the trachea and the carotid artery. Firstly, by listening the breathing, and after that, feel. And the most important is palpations. Don't forget to check the lymph nodes. Okay? And the percussion and auscultations. After that, we transform for thyroid status examination. The face, it's just inspection. The eyes, it's inspect for exophthalmos. And eye movements, its shape, and assess the lid leg. In the hand, we inspect for dorsum, peripheral tremor, inspect the palm, feel the palm, and also the pulse for rate and rhythm, and biceps reflex also. In the leg, we examine inspections of pre-tibial myxedema, and finally we check the proximal myopathy. After doing all this, we thank the patient. Thank you for letting me examine you. Do you need any help? And wash your hands and go for your examiner to present your case, okay? But we have to talk more details about this case, okay? Firstly, an inspection in the field of inspections, we look for the hyperthyroidism symptoms like agitated, anxious, fatigue, okay? And in the inspection, close neck of the inspection of the neck, look for the skin changes, erythema, scars, which means thyroidectomy, masses, goiter, or lymph nodes, and observe the movements of any masses while swallowing, okay? And observe the movements of any masses while protruding the tongue. If it's no movements, that means the swelling related to thyroid gland masses or lymph nodes. And if it's this upward movements, it means the thyroglossal cyst. In the field of palpation, you have to check the thyroglossal cyst while raising, while protruding the tongue. Feel it by palpations. And check asymmetry of thyroid lobe elevations may suggest unilateral thyroid masses, and the evidence of lymphadenopathy, thyroid malignancy. And check the tracheal deviations, large goiter, okay? And of palpations, we have to doing large goiter, extend the infirmity in retrosternal dullness. And on auscultations, we go for thyroid listening, for thyroid pruee. And in the hands, we go for thyroid acropathy, which means grapes, which presented on the torso, a peripheral tremor, hyperthyroidism, a dry skin, hypothyroidism, palmar erythema, hyperthyroidism, sweetness, hyperthyroidism, and palm and pulse rate. We check if it's high, hyper, if it's low, hypo, pulse rate irregular, it's atrial fibrillation, so hyper, biceps reflex, hypo, it means hyporeflexia, hypothyroidism. Inspect the face, if it's hypothyroidism, we notice the sweating, and if it's hypothyroidism, we notice the dry skin, loss of outer side of eye probe. In the eyes, we inspect for exophthalmos, Graves' disease, looking for the evidence of lid retractions, clear visible above the iris, and inspect for anterior displacements of the eye out of the orbit exophthalmos. Check the edge movements, any restrictions of eye movements, and lid leg, as we said, and in the legs, pre-tibial myxedema, and by inspection, which means Graves' disease, and assess for proximal myopathy, hyperthyroidism. Finally, thank the patient and wash your hands and go to present your case with the examiner. Thanks for listening.